Today, the focus is on dermatology because what I do in dermatology is, yeah, I will not talk about many other things. Our topic today is on childhood skin conditions. You know, most of our mothers that we have been interacting with are mothers who most have children who are less than 2 years of age. So maybe I will focus on these childhood skin conditions that affect this age group. And specifically today we'll look at something called hand, foot and mouth disease. Then we'll talk about chickenpox, and then we'll conclude with eczema, what is commonly called eczema, but we'll talk more about it. I think that actually may be the most crucial, maybe to discuss among childhood skin conditions because it's so common. Yeah, so childhood skin conditions. First things first, these are common conditions. Uh, Most of them we should not be worried about that. Oh, my child is going to, to be very sick, very ill, or even have complications, or need to be admitted, or yeah, other things. Other things I don't want to mention that will happen when somebody is sick. These conditions, most of them actually what doctors will call benign, things that will not have any like worrisome consequences, so to speak. So I think that's important for mothers to understand that because one of the things that we have to deal with is the anxiety that comes with a child who has a rash. You're like, what is this? What what is going on with my child and everything? So that's important for us to know that most of childhood skin conditions are actually benign with them. So there are very many childhood skin conditions. They range from infections, things that are caused by bacteria, viruses, and other kinds of infections. But mostly in children, what we see commonly are bacterial and viral infections that affect the skin. Then we have conditions that we call inflammatory conditions, ones that are due to the immune system, some changes that are happening to the immune system, uh, where there are some genetic changes. Yeah? By genetic, we mean something has happened during the development of the child, that there is something that is abnormal in the gene that is making the child have that condition. Yeah. Then we have other conditions like tumors and the rest. Now on to our first we look at infections because the two out of three of the conditions we are going to talk about today are actually infections. Uh, Hand, foot, and mouth disease and chickenpox. Both of those are infections. Uh, Hand, foot, and mouth disease is just called that way because the children get the rash on the hand, on the feet, and they have some rashes also that come in the mouth. It's caused by a virus, something called Coxsackie virus. That may not be important for our mothers to know this virus, but it's important to just know it's caused by a virus. It's not that common, but it can occur. Again, it is self-limiting. What we mean by self-limiting, it actually clears by itself. Yeah, within a week or so, it will have cleared by itself. And actually, there is no recommended treatment that is needed. So, what is important is when how does a child with hand and foot and mouth, how do their skin look like? So they'll have things that are called vesicles, small rashes that have some fluid in it. Yeah, what you'll commonly say, oh, there are some rashes that have water on the skin. That's how the rashes are, and they are commonly on the lower parts of the hand here, down on the feet, and then the child will have some rashes in the mouth that are red and have some whitish appearance around them. most of these children are actually okay. They don't have, spiking fevers, and they're refusing to breastfeed, or they're having diarrhea, all those symptoms that doctors who treat children, pediatricians, would call the danger signs in a child. Children with hand, foot, and mouth are usually generally not very ill, very ill. Uh, but since the rash is affecting them fast, they might be so worried, and the parents, of course, even me, if my child has a rash like that, like, hey, what is this? What is going on? But when you see your child has those rashes that have some fluid, and it has been there for just a short time, and they are generally not sickly. It's just the appearance of the rash that is worrisome. Ideally, for skin conditions, we recommend that you are actually seen at least by a doctor for them to make sure it is not anything worrisome. But when you see your child with that kind of rash, please don't give them antibiotics. Don't try applying something. These things, I know it's not that common these days, but in some places in Kenya, we still have the grandmother who will tell you, there's this thing, you can put it there, it will go away. Hand, foot, and mouth disease will actually go away on its own. You don't need any of those kind of treatments. So when you come to the hospital, we will just examine the baby, we check for fever and the rest of the things. When everything is okay, we will just reassure you, and we will prescribe some ointments that you apply on the skin to reduce the itching and the rest. So hand, foot, and mouth is not something to worry about. We don't really have any specific treatment. So don't use antibiotics and the rest. Just, for most of these childhood rashes, as I said earlier, you just laugh. Respond, hey, what is this, and yeah. So I think that's a brief on hand, foot, and mouth disease. I think later on we'll have some time maybe for questions and the rest. Yeah. Then the next one is chicken pox. I think I think all of us have heard of chicken pox. The doctors will call it varicella, but it's chicken pox. It's also caused by a virus. Yeah, it's also caused by a virus. And how people get chicken pox is from droplets from the nose, yeah, from the mouth, from the respiratory system. Like it is spread like flu. And also another way you can get chickenpox is when you touch the skin, when you get into contact with the skin of a patient who has a child who has chickenpox, especially in the early phase when they have the fluid in the rashes. So chickenpox is generally a mild condition, right? It is mild. Um, Most of the time, it does not stay for more than 2 weeks or so. It will have cleared. And how a child with chickenpox looks like, I'm sure for us adults at some point we have history. We remember when we had chickenpox. At least if you get it when you're a bit older, they have rashes that look very different from one another. But one key thing is that they also have rashes that have fluid in it, and the rashes also look red. They also look red, and they are generally like almost all over the body. They start having that fluid. Those rashes that have fluid start breaking, and then the fluid comes out and it dries, and the child, it's a baby or an older child, the skin looks really, scary and everything, but that's the natural course. That's how the disease progresses as it is clearing. So we should not be worried when we see that. But an important thing for children who have chickenpox is that if your child has chickenpox and they have other skin conditions or other diseases in their body, it can make them at risk of having complications that come with the infection of this virus that causes chickenpox. Because this virus, as I said earlier, it starts from the airway, respiratory system, from the airway. So that virus can also go down the airway and cause pneumonia. Yeah, and also it goes to the blood and can cause something called sepsis, bacteremia and sepsis. That is infection in the blood in simple terms. And also, it can changes in the liver, but most of these changes can actually reversible, that it does not cause permanent damage. But since if a child has other conditions, maybe they have asthma already, they have other conditions, that pneumonia can be severe and they may need to be admitted and so on. And so the importance of that is that a child who has chickenpox at least should be seen by a doctor. They should not just maybe, we treat them at home, this is chickenpox. At least they should be seen by a doctor to make sure they don't have these other conditions, including even a child who has eczema and gets chickenpox is at risk of more complications in the skin because they get bacterial infections easily and the rest, which can make them have scars and everything. Because now I know in other diseases we are worried about other complications that could be fatal, but at least for the skin, having a scar is a complication, which as skin doctors we wouldn't want anyone to get a scar if they shouldn't. So yeah, if a child has those rashes, it normally starts like on the chest, the back, it goes like all over the body, and the child will have some fever. They will look a bit sickly. They will look a bit sickly. They will need to see a doctor. So for the treatment, again, you should be reassured. The treatment for children, we don't really do much. What we do is mostly what we call symptomatic treatment. We will give medicine for the fever. We will advise some applications. There's a lotion called calamine lotion. I know it's commonly available. We use to apply on the skin to help it itching and the dried fluid that is there. And also, if there is infection, we give antibiotics, but this should only be prescribed by a doctor. Then, for those children who are at risk of getting more complications, we recommend we give them antiviral agents. We recommend antiviral agents, which can be medicines for swallowing, or if they are very sick and they are admitted, we do we inject the medicine through the vein, what we call intravenous injection. And the commonly available drug that we use is something called acyclovir. It's a bit costly, but it's available. It's available. At least in most setups it is available, and it helps to clear the rash quicker and reduce risk of those complications. But generally, chickenpox, no need to worry. It is just to recognize a child who has fever, when they get fever and they get these rashes that are all over the body, and it has some clear fluid, and it is red. Below the fluid, it is red. That's when we suspect chickenpox. So maybe a question that commonly asked by caretakers when they bring children with chickenpox is, can my child go to school now that they have this rush? Now, should they go to school? Should I take them to the daycare? What should I do? Should I leave? You know? So, as we have said, it is easily transmitted from one person to another through the respiratory, the droplets from the nose, the mouth, and also through contact with the skin, so that fluid on the skin. So commonly we say 5 days before they have gotten the rush, when they have the fever and everything, when the rush is about to come, we call it that prodrome period. That time is when they can transmit from one person to another. And that infection can still be transmitted average of about 5 days after the rash has started. So we have this 10-day window, 10 days before the rash and 5 days after. Once the skin is having, the fluid is drying, they're just having those dry things, we call them scabs. That child is not infectious to the people who come into contact. So if it is within 5 days uh, prior to the rash coming and 5 days after, that's the time they can really transmit the rash from one person to another. But after that, they can go to school and everything if they are stable. If they are stable, if the doctors are just recommending medicine for swallowing, and it is the rash is actually dry, they have no fever, they can go to school and the rest. But if you're worried, uh, of course, they can be home for longer, but generally that 10 day window is what is recommended. So yeah, that's about chickenpox. Really. I think maybe some of the things maybe we deal with maybe when we have some comments uh, later on. The last condition, which is actually, in my opinion, is very important, since it's actually very common. Um, I know there are very many misconceptions about it. It's something that when a parent or a caregiver is told their child has that disease, the first reaction is normally they become really shocked. Is it me who is the problem? Is it my spouse? Is it who? Yeah, I'm talking about eczema. Something is called eczema. Um, we call it atopic dermatitis also. Eczema is a common term that is used, I think, in Europe, in the UK mostly. They just call it eczema. So eczema is, when I say eczema, I also, it's synonymous. It's the same as atopic dermatitis. So the reason I find it important to say that it's also called atopic dermatitis is because that name tries to explain what the condition is. This atopic dermatitis is actually a condition that is caused by various factors. There are various factors that come into play to cause that condition. So one thing that we should understand, atopic dermatitis it is not cancer. It is not like when a child is diagnosed with atopic dermatitis, it doesn't mean that they can't live a normal life. It does not mean that they cannot go to school. It does not mean that their potential will be impaired in any way. The reason I'm saying this is because over the years, this in dermatology, this is one of the conditions that has really been, I can say, well studied over the period. So if you see a dermatologist, for sure, you should be at rest that your child will be managed well. And actually, as we will discuss the management, this management is actually simple, and this disease can be controlled. So, as I've said, there are very many factors that come into play to cause atopic dermatitis. So, the word atopic just means, in simple terms, it's the tendency for somebody to have allergies. So allergies is broad. These children with atopic dermatitis, it's not that atopic dermatitis is allergic, is an allergic condition. No, it's actually there are changes that have happened in the genes that are making them at risk to have this disease. So one of the factors is
Hi,
genetic.
Doc.
There,
Hi,
sorry?
Doc. 1 minute. We are hearing an echo on your side. Eh?
Yes, sorry. Like, maybe I'll need to put on headsets or something.
Yeah, maybe that, because
The
this is
echo is
what mothers
everywhere.
have come for. But no, it's. I think it's cleared now.
Okay, let me.
anyone who's joined in, as we give Dr. a minute, please post your questions in the comments. We are seeing them. He'll respond to them after he's done with the discussion.
Let me try and put.
Now we can't hear you, Doc, at all. Can you hear us? Can you hear me, Doc?
Yes, yes, I can hear you. Are you able to
Much
hear me?
better. Yeah, now
Oh,
much
the
better.
echo
We
is
can
gone.
hear you better. We
Ah,
can
that's
hear you
good. That's
better.
good. So, in atopic dermatitis, what is commonly called eczema, I was saying there are many factors that come into play to cause this condition, and one of the factors is genetic. There are some genes that are responsible to cause this condition. Um, those changes that have happened in the gene have normally are changes that already happened when the child is developing. They are not something that comes maybe along the way. Yeah? So they are already changes that have happened at the gene. Um, the other factor is in children with eczema, they have a problem with maintaining the normal barrier of the skin. We have a barrier on the skin, yeah, that is formed by a combination of some things called lipids. Oh, sorry. Our mothers are still hearing an echo. I don't know what is happening. Um, it's still there.
Yes, actually, yes.
Wow, wow. I've tried to use the
You're using
headset.
your laptop?
I'm using my phone. Maybe I go to the laptop. Let me try and join with my laptop and see.
Okay.
Because I think this is very important. Sorry about that. So maybe as I try to connect to the computer, if there are any, I don't know if we can address some questions,
Yeah.
or let me connect first.
Okay.
Because now I've remembered if I try to answer the question, there's still the echo.
There's still the echo. That's the issue. And when you're talking now, there's no echo. Once you start explaining, echo.
Hmm. Sorry. Now I have the link on WhatsApp.
Try going to the YouTube page. How will we do
Yes,
it? And then see if you can join the live because you'll have to get out, then get back in.
yes.
That's a problem. And we really struggled initially getting you on.
Sorry.
Alternatively, we can change the room. If you're
Yeah,
next to
alternatively,
a window,
yeah, it will actually be the room, eh?
yeah,
I hadn't thought of that.
you can give us a tour of your nice establishment.
I'll give you a tour.
Then you can try go somewhere with a bit more furniture because it tends to trap echo.
How is the echo there?
It's there, but at least we can hear you. Um, Mothers in the house, can you hear? Can you hear him? If you can, just either comment or like, so that we know if that's better for you. I've seen Diana in the comments and whom else? Just see.
How about now?
Maureen and Diana, is it better? I hear it, I'm thinking it's better. Or maybe you can just type and let us know. Pole daktari, we are sorry.
It's okay. It's okay.
It's better,
Ah,
yeah.
great.
Karen says it's
Ah,
better. We can work with this one.
that's good. That's good. So, atopic dermatitis. Let me just go over what I talked about. First of all, I was just trying to dispel or what some myths that are there about atopic dermatitis. Um, I was just saying that atopic dermatitis does not mean a child being diagnosed with atopic dermatitis does not mean that they cannot live their life as normal. It does not mean that they cannot live to their full potential. Does not mean that they cannot go to school, grow normally. Um, so there are very many factors that come into play to cause atopic dermatitis, but there are three main factors that have to be present to now have a child to have those skin changes. And one of them is genetics, right? So there are some genes that have been found to be responsible to cause atopic dermatitis. These genetic changes happen during development of the child, and they are inherited from the parents. Um, so there's the genetic factor. The other factor is children with atopic dermatitis do not have a normal barrier, skin barrier. Normally on the skin, we have a barrier that protects us from the environment, like irritants in the environment that makes the skin not dry, so that when maybe you get into contact with a certain soap, it does not make you sensitive to that soap. But now children with atopic dermatitis do not have a normal barrier function because of those genetic changes. So they don't have the some of the layers of the skin are missing some small components there. Yeah, yeah. But again, the missing components do not mean that they are at risk of cancer or something like that. Then the other factor, which is actually now very crucial, that uh, leads now to the rashes, is something called immune dysregulation. The immune system now acts in an abnormal way, yeah, and now causes the symptoms of atopic dermatitis. So there are some immune dysregulation that happen in the immune system, because the immune system is the one that fights bacteria, fungus, those infections, viruses. But now in atopic dermatitis, the immune system is now acting abnormally and now causing something called inflammation in the skin. And now the children get one of the key symptoms, which is itching. They start having itching of the skin. Uh, so when those factors come into play, how does a child with atopic dermatitis, how do their skin behave, or how does the skin look like? So one of the key things in atopic dermatitis is itching, itch, because and actually that's what makes the child uncomfortable. It makes the parents very uncomfortable, and itch will make the child not sleep, not rest well, and this makes now children fail to go to school because they are eating the whole night and everything, and all that. So another symptom that comes with atopic dermatitis is now the rashes that come with it. They get some small rashes that join together to form bigger rashes, yeah, on the skin. And for children who are less than 2 years, mostly infants, which I think most of our mothers, that's the target population, they get rashes that come here on the cheek. You see a child has some red rashes here that have some white scales, white things on the cheeks here. It's like coming to the neck, behind the neck, or in front of the neck here. It comes on the knees, yeah, on the elbows. As the child is growing, these rashes come on the front part of the elbow, yeah, behind the leg, yeah. But sometimes it can go now all over the body. And the rashes of atopic dermatitis, other than being very itchy and having the rashes in those specific areas, the face, the neck, and behind the legs and the elbow, the rashes normally go away, then they come back. They go away and they come back. And what makes them come, there are things called triggers. Because the skin is already sensitive because of those genes that have changed, and also because of they don't have a normal barrier, and because of that abnormal response. So when they get into contact with triggers like soaps that are harsh, things that have fragrance, clothes that have um, some thick, you know, fibers like woolen clothes. Those ones are not good for children with atopic dermatitis. Things that fabrics like nylon, those ones that are those ones will just irritate the skin. Those harsh soaps, moisturizers, lotions that are really have a fragrance, you know, even a cologne from the mother or from the father or any visitor can make a child with atopic dermatitis, uh, kind of have a reaction. Because on top of having sensitivity in the skin, these children, because they have atopy, what we had said earlier, they have a tendency to have allergies. So they also normally have allergies in the nose. Yeah, they also have some of them can end up with something called asthma. Yeah, they have some difficulty in breathing and the rest. And actually, why it is very important for us to to let you know about atopic dermatitis, and for all of us to know to partner and manage these children well, is because if we manage them well when they are really small, yeah, we will even prevent them from having other allergic conditions like asthma. When they grow, when they continue to grow, we will reduce the chance of them having those allergic conditions like asthma. And again, we will be able to reduce, lack of sleep, which makes them less productive, school, and the rest. And also, for our mothers, I know we also want to sleep. Yeah, we also need to go to work and everything. So when we manage our children well, we will all, the benefit is for all of us, not just the child, not it's for all of us. And then so when we identify a child who has atopic dermatitis, so for you as a mother, when you have a child who is having a rash that is coming and going, and the child is very uncomfortable, for those who are less than a year, they will not reach out their hand to scratch. But you will see the baby is like turning their neck like this, trying to scratch. The child will be uncomfortable, is just crying, and you've done everything. You have fed the child is okay, but has some rashes and they are really uncomfortable. So when you see a child has had that rash, not once, not twice, and what is important is also the age of the child, because atopic dermatitis normally starts from 2 months of age. When your child is less than 2 months, it is unlikely that they will have signs of atopic dermatitis. It normally comes later on, when they're about 2 months and older. So when you have a child who's more than 2 months, they're having those rashes on the face, on the neck, that they are really itching, and they have some fluid that is coming out. When they stay for a few days, they start having some pus because bacteria comes. Because as you remember, there's some abnormal immune response, so they are not able to fight the bacteria well. And there's a bacteria that likes to stay on the skin of these children with atopic dermatitis. And also they can get viral infections on top. So when you have a child who has those rashes, and later on maybe they have those pus coming out of the skin, or they start having a fever, you need first of all, as we had said earlier, for childhood skin conditions, most of them are not fatal. Yeah, but with complications, it can increase the risks of bad things happening. So when you have a child who has that rash, the first step for you first is to relax. You should not be worried because now at least you have the information. You will have an idea. This this could be atopic dermatitis, which uh, generally it's not fatal. It can be managed. Yeah, it can be managed. But when they start having a fever or anything, now that's a danger sign. Generally for any disease, that's a danger sign in a child. Huh? They actually need to be seen by a doctor as early as possible. Another thing with the skin of children with atopic dermatitis, one key thing, if you see your infant, your baby has a skin that is dry, the skin is dry. You moisturize the skin, you have washed the child, you have applied whatever moisturizer you use, and after a short time the skin is dry. The skin is dry. Then a child who, when you move from maybe from one place to another, and oops, they get a rash, and they are really itching and everything. That's how you can suspect they might be having a sensitive skin. Then another thing about the triggers, other than the woolen clothes, nylon, other than harsh soaps that have fragrance, moisturizers. This moisturizers, like I don't want to mention any brands, but we have moisturizers that are commonly used, that we commonly, we get advised by, my mother, my elder sister, me, I used this for my child. If you see your child has a sensitive skin, kindly just seek guidance on which moisturizer to use from doctors. Don't get advice from maybe close family members. Our family members really mean well for us, but the challenge is that they might not know that your child is having a sensitive skin. So they will tell you, use product X. Yeah, I know our mothers know the common products that we use. Because we are on YouTube, we can't start mentioning brands and everything, but there are those common brands that are used, and a child, they are labeled, baby jelly, baby powder, baby, you know, you know, such, and you can use such, and the baby still is having a reaction because those products are used for babies generally. They are not specifically for babies with sensitive skin. Yeah, yeah. So that's one of the triggers. Also moisturizers, and also one thing for mothers who have children who are now transitioning, who are around 6 months of age, transitioning now, they are starting to introduce other feeds other than breast milk.
Breast
You
milk.
know, yeah, because we recommend, my colleagues, the pediatricians recommend exclusive breastfeeding for the first 6 months, which is actually advisable. We really advise that. But after 6 months, we start introducing other feeds. Those Some of these children, although it's not a very big trigger, some of these children, when they start taking other feeds, is when the rush tends to come. So the only way we can know is we are really relying on our mothers, because they are the ones who, are with the baby all the time. So if you're keen, you should be vigilant during that transition period. You should introduce one one feed at a time. Yeah, so that you can tell when they get maybe a reaction, like, well, probably it was this. Because when you come to the hospital, we have tests that you can do to check for food allergies. Yeah, but your guidance is really important. You can even avoid doing those tests if when we evaluate the child and you give us information clearly, we know it is this kind of food. Commonly things like cow's milk, uh, uh, groundnuts and the rest, soya and some of those. But it depends on the child. So that's another trigger. So in summary, the triggers are normally the harsh soaps that have fragrance, moisturizers that have additives, then materials, fabrics like nylon, wool, and most clothes for children are made of wool, not keep them warm and everything. And also, the food can also act as a trigger. Another thing is environment, sweating. Sweat in itself irritates the skin in children with atopic dermatitis. So you might take your child, you have gone for a vacation to the coast, and the child now is just worsening and everything. So sweating is another trigger. And something that is common in infants, the small babies, is because they have a lot of salivation. Saliva itself is an irritant to the skin for these children. So they will start having rashes around the mouth, and now that's where the inflammation comes around the cheeks there, because saliva itself is an irritant. So there you'll just wipe it well with so we recommend cotton, cotton bedding, cotton clothes, cotton, everything. Even the cloth that we use to to wipe the baby should be cotton, everything. We recommend cotton for these children. And I know it's difficult to get 100% cotton, but they are available. Mostly second-hand clothes. That's where we get affordable cotton clothes. Then, then now I think I've now gone to how we manage these children. First, you should be reassured this is a condition that can be controlled. Of note is that we cannot cure it because you remember I told you there are some changes that have happened in the gene, yeah, and we are not able to change those genetic changes. But you should not be worried because as the child is growing, yeah, for children with atopic dermatitis, way more than half of them will have cleared by the time as they grow. By the time they are 12 years of age, they will have cleared. So as we are waiting for that time to come, we can't tell you to just, wait until your child is 12 years. No. So this is how you're going to take care of your kid. If your child has signs of atopic dermatitis, first, that child, we should be bathing the child once a day. Hmm? I wish we did a survey and ask you, our mothers, how many times do you wash your child? I get mothers who wash their children 3 times, and all that. So, because they have a very dry skin, we just recommend bathing them, washing them once. You can choose to wash them like in the evening, and the water that you use should be lukewarm, lukewarm water. Lukewarm water is water that is not too hot, not too cold. The one that you can dip your hand and it's okay. And you wash the baby in the shortest time possible. Yeah. In our literature, in our books, they teach us that we should wash the child for at most 3 minutes. Yeah. So I don't know how practical that is, but I think it's possible since the child has a sensitive skin. It's something that you can deliberately practice to do. You just wash the child for only the shortest time possible. Actually, 3 minutes are enough. You just clean the child, and immediately after cleaning the child, you just cover them with a cotton towel. Immediately after they are from the water, you should moisturize their skin. You should apply the moisturizer. When the skin still has some, when it's still damp, when it still has some moisture, you apply the moisturizer. There's a product that I think I would recommend openly here. There's a product called emulsifying ointment. It's a product that is actually made in Nairobi. Uh, I've been like in Uganda for some time for training, and we actually use that product that we get from Nairobi. So for us who are in Kenya, I think we even get it it's easily available. Something called emulsifying ointment. It comes in a 500 gram container. Yes, yes.
Yeah.
has a red
has a
top,
red top, you know.
that
Yeah.
moisturizer
That
is really
moisturizer
good
is
because
really good
it is
because
just
it is just
plain.
plain, you
You
know.
put it
You
on your
put it
nose
on
like
your
this
nose
and
like
there's
this and
nothing,
there's nothing,
it,
you know.
it has no
It has
additives.
no
So
additive.
that's what I
So
would
that's what
recommend.
I
You
would
moisturize
recommend.
the skin well
Moisturize the
using
skin
that.
well using that.
Then after that,
After that,
during the day,
during the day,
you wash the child. You
you
can
wash
wash
the
them
cells.
in
You
the
can wash
morning
them
and
in the
evening.
morning or
But
evening.
throughout the
But
day,
throughout the
you should
day,
apply
you should apply
this this
this
moisturizer
moisturizer
up to 4 times
up
a
to
day.
four times a
So
day.
remember,
So remember,
you apply this
you apply this
moisturizer
moisturizer
when the child
when the child
is not when you
is
have not
not when
washed
you
the
have not
child
washed the child
during the day.
during the day.
You get now in the evening
Now in
after
the evening
washing the
after
child,
washing
you
the child,
apply it.
you apply
But
it.
during the
But
day,
during the
you have
day,
not
you have not
washed the child,
washed the
but you
child,
still
but you
apply the
still apply the
moisturizer because
moisturizer.
you remember their
Because you
skin is
remember their
really
skin
dry.
is really dry.
So you should
So
apply
you
the
should apply the
moisturizer because it will
moisturizer
help
because it
now
will help
take
now
care of that
take care of that
barrier of the
barrier
skin
of
that
the
is not
skin that is
there
not
in
there
their skin.
in their
So the
skin. So the
moisturizer,
moisturizer, you
takes
know,
care of that.
takes care of that.
So you
So
can use
you can
that
use
moisturizer
that
called
moisturizer called
emulsifying ointment.
emulsifying ointment.
For the soap,
For
sorry,
the
I didn't
soap, sorry,
mention
I
the
didn't
soap.
mention the soap.
The soap that we
The soap
recommend
that we
for children
recommend
with
for
atopic
children with atopic
dermatitis is
dermatitis is
there are types of
there are
soap
types
that
of
are not
soap that are
true
not
soap.
true soap.
Yeah,
Yeah,
we call them
we call
synthetic
them
detergents.
synthetic detergent.
Short form, they call
Short
them
form, they
Syndex.
call them Findex.
And one
And
common one
one common one
that is
that is
available, I think
available, I think there is
it's available
it's
all over the
available
world
all over the
actually.
world
There's,
actually.
there's a soap called
There's a
Oli,
soap called Oli.
sorry,
Sorry,
why am
Latin.
I
Why am
forgetting
I
the soap?
forgetting the
Dove
soap?
original
Dove
soap.
original
Sorry,
soap. Oh, Dove original. Okay.
Dove.
Dove.
There's a brand of
There's
soap
a brand
called
of soap
Dove,
called Dove,
but
but
specifically you get the
specifically
one
you
that is
get the
written
one that is written
original. The
original.
original is
The
normally
original is
written
normally written
with a blue like
like
color
color
branding.
branding.
That's a good soap
That's a
because
good
it
soap
does
because
not
it does
remove
not
the
remove
oils
the
from the
oils
skin.
from the skin.
Because children with
Because
atopic
children with
dermatitis,
atopic
they already
dermatitis,
have a
they already
problem with
have
the
a
barrier
problem with the barrier
of the skin, which is
of the skin,
normally
which is normally
contributed by the oils
contributed
of
by
the
the
skin.
oils
So it
of the
does not
skin. So it does not
remove the oils.
remove the
That
oil.
soap
That
doesn't
soap
affect
doesn't
something called
affect something
pH,
called pH,
the acidity
the
of the
acidity
skin,
of the
because
skin,
normally the
because
skin
normally the
is
skin
acidic.
is
And
acidic.
if the
And
pH
if
is
the pH
affected,
is affected,
it brings risks
it brings risk
for these children.
for these
So
children.
we
So
recommend
we
that
recommend that
synthetic detergent
synthetic detergent
like
like
Dove original
Dove
soap.
original soap.
There are other soaps
There are other
called
soaps
oil.
called
There's a soap called
there's a soap called
Oilatum.
Oilatum.
But personally, the
But
one I have
personally, the one I
experience
have
with
experience with,
and I know it
and I
works
know
is
it
Dove
works, is
original
Dove
soap
original soap
because it's
because
actually
it's
available
actually
and it's
available and it's
affordable.
affordable.
Uh,
Uh,
for low
for
income
low
areas,
income areas,
we normally
we
recommend
normally
the
recommend
usual
the
washing
usual
soap.
washing soap.
The ones
The
we
ones
use to wash
we use to
clothes,
wash clothes,
like
like
Jama and the rest.
Jama and the rest. Okay.
That is good
That
because
is
it
good
doesn't have
because it
the
doesn't have
smell,
the smell.
but the challenge is
But the
that
challenge is that
that one affects
that
the
one
pH
affects
of
the
the
pH
skin,
of the skin.
and it
It
really removes
really removes
the oils of
the
the
oils
skin.
of the
So
skin.
we wouldn't really
We wouldn't
recommend
really
that.
recommend
If
that.
if you can
If
afford
you
the
can
Dove
afford the
original
Dove
soap,
original soap,
I would advise you to
I would
use
advise you to use
those soaps like Dove
soaps
original
like
soap.
Dove original
Then
soap.
the clothes should
Then
be
the clothes
cotton,
should be
even the
cotton,
bed
even the
sheets
bed sheets
and everything.
and
So once you
everything.
do
So
that,
once you do that,
the skin of the
the
child
skin of the
will
child
be
will be
maintained, and they
maintained,
maintain
and they maintain
that
that
skincare routine
skincare routine
throughout
throughout
their childhood,
their
and
childhood, and
they will
they
actually
will
not have
actually not
flares,
have flares.
because what we are
Because
worried
what
about
we are
is
worried
flares.
about is
When
flares.
the rash
When the
comes,
rush comes,
then it
then
causes the
it causes the
irritation,
irritation,
and they have
they have
infections on top and
infections on
everything.
top and
So
everything.
once we do
So once we
skincare,
do
we are able
skincare,
to
we are
treat.
able to treat.
That's the main
That's the
treatment
main
for atopic
treatment for atopic
dermatitis.
dermatitis.
The other
The
treatments
other
are tubes
treatments
that
are
we use
tubes
to
that we use to
control
control
the flare once the
flare
child has
once
a
the
flare,
child has a
which I
flare,
think
which I
those
think
ones
those
they
ones
have to be
they have to
prescribed.
be
So when you
prescribed.
see a
So when you
doctor, they
see
will
a
be able
doctor,
to
they will be able
prescribe
to
those tubes,
prescribe
and they
those
are used
tubes, and they are
for
used for
a short period
a
of
short
time.
period of
Then we
time. Then
reduce them
we
over
reduce them
time.
over
But
time.
the main thing
But
is
the main thing is
skincare, skincare,
skincare,
skincare.
skincare,
So
skincare.
you just
So
wash
you
the
just
child
wash the
once
child once
using a soap
using
like
a
Dove
soap like
original
Dove
soap,
original soap,
lukewarm water.
lukewarm water.
Within 3 minutes,
Within
the
3 minutes,
baby
the
is
baby
out of the
is out
water.
of the water.
You dry them using
Dry
a
them
cotton
using a
towel,
cotton
and immediately moisturize using a moisturizer like the emulsifying ointment that we are going to pin it there. We'll just type it there for you to be to know it and recognize it. Yeah, so that's the main thing about atopic dermatitis. If you're able to do skincare, for sure, you will not you will not need to be seeing the doctor every, every month, every 3 months. You might only need to see the doctor, for vaccinations. Eh? Yeah, and that we are happy to see babies just for vaccination. Yeah, not when they are sick. When babies are sick, we are also sick as doctors. Yeah, yeah. So I think that's like a summary of atopic dermatitis and the rest. So yeah, thank you so much, Dr. Jemima, for this opportunity. And yeah, I think
I have
that's the end.
questions. Are you seeing all this? These are all questions.
Wow. Okay,
Yeah,
that's good.
I'll pin the question. I can't type right now. Apparently, I can only if I try in a pair charts. So the oil is emulsifying ointment. We'll put it in the group as well.
Yeah,
Or once this is done, we'll share the whole video and then put it there. If
yeah.
YouTube gives us that option, I don't know. Yeah, but Doc, I have a few questions, starting with one that was asked on the group, on the chat
Mhm.
rather, by Rachel. She's saying that it's a specific question.
Mhm.
It's baby is 1 year 4 months, having rashes on her lower back to the neck area, and her skin has pallor.
Mhm.
She's been using Epimax without a change. So she's
Mhm.
asking, what next?
Okay. So thank you for your question, Rachel. The child is an infant, and they have those rashes that you're saying are a bit red, and it seems they have had it for a long time. It may be difficult to tell exactly what it could be, but from that description, um, it could be the child has a sensitive skin. Eh? So maybe to just highlight as I answer that question is that when a child has a sensitive skin, um, all those the skincare routine is effective as a package, not just the moisturizer only, not just the soap only, not just the cotton clothes only. Yeah. So maybe Rachel, you may go ahead and try using the skincare routine as a whole. Yeah. And then I would advise at least they be seen by a pediatrician. It would be good to be seen at least by a pediatrician or even a general practitioner. Would be able to assess the child better to make sure they don't have any other worrisome signs. But you should not be worried. As I said earlier, most skin conditions in children are actually self-limiting. They will clear with time. So what I would advise you to do, the next step is just try using this skincare routine for children for your child and see the change. Yeah. But in the meantime, you should also see a doctor to guide further on the rashes. Yeah. Yeah.
Thank you, Doc. I'm also seeing another question from Diana. Is eczema and blood infection related in any way?
Okay. Okay. Thank you, Diana, for your question. Now, eczema is, as you have said, simply put, is a sensitive skin. Yeah, a child with a sensitive skin have eczema, also called atopic dermatitis. Blood infection. Uh, Technically, we don't have like a term like that, but what I understand from that, from the common conversations that we have with 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 our clients, and you'd correct me if my understanding of what you mean blood infection is. I assume you mean that blood infection is when you have like maybe a bacterial infection or what that is now in the body system that is in the blood. That one for us we call it sepsis. That one is really separate. It is very different from atopic dermatitis because atopic dermatitis is in for us we call them it is an inflammatory condition. That blood infection is an infectious condition. So they are totally different conditions. And one of them, which is atopic dermatitis, we are able to manage it just easily with skincare and other treatments depending on the severity. But blood infection is a totally different condition, which is normally treated when a child has to be admitted. Yeah.
All right, thank you, Doc. There's a question I've seen here on soap
Yes.
that I think you alluded to, but I'll also ask. We see some of our mothers coming in using sunlight, and specifically specifically sunlight. So,
Mhm.
so I wanted to just clarify from you
Mhm.
if that is advisable, and we also have the trying to not use a brand name, the
Mhm.
lubricating agents, the petroleum jellies. Actually, the petroleum jellies, you hear from when my child was born, I was using these petroleum and they swear by it. So I wanted to hear from you as a dermatologist, what your opinion is on that.
Yeah. Thank you. Now, maybe I'll start with the soap. For sunlight, it's a true soap. Yeah, there's a way we classify soap. It's a true soap like any other soap. So I do not recommend sunlight for children with atopic dermatitis because it will affect the pH of the skin and also affect the oils that are on the skin. So we recommend those synthetic detergents that are not true soap. Yes, like the Dove Original, Oilatum, and the rest. Yeah. So for sunlight, I wouldn't advise. Now for the jellies, uh, I feel like mentioning a brand, but I know.
It's so hard. It's so hard. I almost want to bring them to you. And this one, and this one.
Now for jellies, we have very many brands, and actually most companies are now trying to uh, specify. This one is original. This one has aloe vera. This one has cocoa butter. This one has this. So
And there's
generally,
a cow one. We can actually call it the cow one. Is the cow one okay?
now the cow one, uh, I have experience with it. Uh, Generally, it actually has a scent. That's the first simple thing you can assess a moisturizer that is good for a child with atopic dermatitis. You just, try and smell if it has a scent. That the cow one has a scent. Um, I wouldn't recommend that for children with atopic dermatitis. The second reason I wouldn't recommend that cow one is because the way it is made, it is not thick. It is not thick. It is very kind of light. It's kind of light. So that is why I think it is being used by, sorry to say, it is being used actually by, apparently by models and everything, because it does not clog the pores and everything. Yeah, so that's besides the point. But it is a bit light, and for skin of children with atopic dermatitis, we want a
They need
moisturizer that will stay there for a long time. We want a thick, non-scented moisturizer. That's why specifically I've had to just mention that brand, that emulsifying ointment, just for the sake of, yeah, that's why I recommend that because I have experience with it. Yeah, we have not been paid to say it, but yeah, we will say it for the benefit of our mothers.
the mothers. True.
Yeah.
Okay. So the other question, I've seen something in the chat before I ask my questions. Where is that question? Do babies outgrow, or is there a cure for eczema, or we just manage it? Also, I'm seeing the next question is there. What do babies outgrow eczema, and at what age? And what of adults who still have eczema and they had it since childhood? Uh, what differentiates babies who will outgrow it and those who do not? And thank you, Diana, for helping us with the name there.
Great, great.
Now, atopic dermatitis. one of the factors that causes it is actually there's some genetic changes. Yeah? So we are not able to cure. Uh, there's a lot of research that is ongoing on how we can target mostly the abnormal immune response, because scientifically speaking, it is very difficult to target genes and try to alter the gene. It would be a very expensive and uh, I don't want to say that we are giving up on doing research on gene therapy, but it's something that is really difficult to do. And to change genes, we might affect other things. So that said, atopic dermatitis cannot be cured, yeah, but it can be controlled, which is actually important because that, that's what we want. You can't look at a child.
Daktari, I've lost you. Anyone else who can hear Doc? I don't know whose internet has a problem. Not sure if it's mine or his. In the chat box, can you hear us? Oh, no.
Sorry,
Oh,
sorry,
there you are. There you are.
sorry,
Okay.
sorry, sorry for my internet. Sorry, I was saying atopic dermatitis, since it's a genetic, there are some genetic genes that are involved. We are not able to cure, but we are able to control. That is the good news. We are able to control because we know what is affected in the body, and once we control it, the child lives a normal life. You cannot look at a child and say they have this genetic defect, yeah, but you can look at a child and see the rash and know this is atopic dermatitis. So if we are able to control the skin uh, condition, I think, in my opinion, it is as good as a cure, because we know the cure to change genes may not be a very easy and favorable option. So we are able to cure. We are able.
Not cure. So as we struggle with Daktari's internet, oh no, there you are.
Sorry, sorry.
It's okay.
I'm
We
having.
actually are coming to the end of our session. I think that's why your internet is like, yeah, we are done.
Sorry, sorry. We normally have some internet challenges where I am.
No
Yeah, but
problem.
yeah, it
We are
will be well.
acceptable. Yeah.
So, in terms of outgrowing, most children with atopic dermatitis will outgrow the sensitivity of their skin by the time they are 12 years, 12 years of age.
Okay. Yeah. So we're struggling. I was hoping to be able to ask him a few more questions. Um, but we can and we will continue on the group. Thank you everyone who has joined us today. I am still buying a few more minutes so that we can have Daktari with us. Uh, I've seen a question on Doc. Don't worry, we'll continue on the chats. But
Oh, okay. Okay.
yeah, I've seen a question on where can you be found. Someone wants
Ah,
to consult with you, and please tell them also about your YouTube channel. Yeah,
ah,
so
all
that
right.
we also know where to come to for help.
All right. So currently, I'm attending training in Uganda, but I'll be in Kenya in the next few months. I'll be based in Tenwek Hospital. Tenwek Hospital is located in Bomet, which is about 4 hours from Nairobi. But I have my colleagues that I'm happy to recommend to to you wherever, depending on the town or city where you are. I have colleagues who are practicing in Nairobi, Mombasa, Eldoret, Nakuru. Yeah, so feel free to. I can refer you accordingly. But for now, I'm out of the country. But yeah, I'll be back home shortly.
Yeah.
Yeah, I have a YouTube channel. It's called Medical Media East Africa. Yeah. So you can find me on YouTube, subscribe. I've been doing other videos, but now I'm trying to focus mostly on dermatology. Because that's what I do. Yeah. Thank you for having me once again, and
Thank you.
for the audience. Thank you, Dr.
Yes. So, Dr. Be blessed. We had an overseas local doctor. We are grateful for you. Uh, we had many questions. For example, do hand and foot recur? Chicken pox, does it recur? And all these things. Also, preventive measures in pregnancy. Like, is there something I can do to make sure my baby doesn't get eczema? Now that we are wrapping.
I know, I know.
But is there something you can do to prevent your child, by the way?
Literally, we don't have a way. We don't have a way to prevent because to prevent it, you'll have to alter the genes, right? And yeah, so we don't really have a way to prevent it in the prenatal period. But what is important with atopic dermatitis is that to just identify it and control it early. Yeah, yeah, yeah.
Thank you, Doc. I'll just summarize what you said about skincare routine only. The rest, please rewatch the video. So, Dr. talked about cotton everything, from towel to clothes to everything, cotton everything. He talked about bathe baby once a day for 3 minutes, using synthetic soap like the Dove original soap. We've not been paid, by the way. We should have gone for payment. But yeah, using like the Dove original soap or the oil items and such things. If it's not affordable, the home soaps can be used, but there's caution, it can change pH. So the plan is to just save for that one soap for the baby. Yeah. And it can only be used by the baby, so at least that saves it for a while. Dry with cotton towel, moisturize skin while still damp, use emulsifying ointment. Um, Whether the genes are from mother or father, it can be either. It can be either. Yeah, so repeat applying the ointment on the baby the whole day because they tend to have a dry skin. Yeah. And then if they start getting a flare or any infection, take to the hospital. Please don't buy fluconazole and steroids and all these things in the chemists. Please don't. Please don't. Yeah, because it can really affect your baby in other ways, as you had some of them come to the throat and all these things. So we don't want to complicate and then mismanage you. So tunawapenda, we love you very much.
Yeah.
Be blessed. We can continue the discussion in the group. Daktari is on the Wheels for Life group as well, so you can still ask him your questions from there. And thank you so much. Thank you, Daktari. We
Thank
are
you.
really, really honored to have you. God bless you so
Thank
much. Thank you.
God bless you too, Dr. Thank you for this platform. We can do it more often. Why
Yes,
not?
yes, yes, by all means.
Yes.
Thanks. Thank you for
Thank
that.
you.
All
Thank
right,
you.
so be blessed and bye. Bye, everyone.
Bye.